Mark Goldberg, welcome to the Naked Connection. We're so excited to have you today.
Thank you so much for having me.
Just to lay the groundwork for anyone that's tuning in about what exactly erectile dysfunction is.
I like to distinguish between the clinical definitions and some of the experiential definitions, because sometimes those could be a bit different.
Mm,
So generally, I think from a clinical perspective, when we think about erectile dysfunction, we're thinking about a somewhat persistent challenge in either gaining or maintaining an erection, or challenges with maintaining an adequate amount of rigidity. Um,
mm,
I believe the diagnostic criteria is that this is occurring more often than not over a period of 6 months.
mhm,
Um, and the reason for that is because it's quite common for men to experience erection inconsistencies as part of just normal function.
mhm,
So that's much more of the clinical definition. Experientially, though, um, there are many men who, long before they hit the 6 month um, time mark, or even if erections are generally consistent, but even at times they're not gaining or maintaining an erection, it could be a very distressing experience, and a lot of those men will try to seek out help to try to eliminate the possibility of having some kind of erection challenge at all.
mhm. Yeah. And what would you say when having that experience is really the primary emotion that a guy carries as they're moving through that?
Um, that is a great question. Shame is one of the big ones. Uh,
Mm,
Shame. Um, I think during the actual experience of erectile dysfunction, a lot of times it's panic, uh,
mhm,
like intense fear, worry. From a cognitive perspective, a lot of catastrophic thinking that goes on. But I think the aftermath emotion is primarily shame.
yeah. Yeah. And when I was preparing to talk with you, I was reading some statistics on ED, and it was saying something like in America, in the US, upwards of 24% of men experience or have been diagnosed with ED. And so understanding the prevalence of it and just the experience of the panic followed by the shame, what is, I guess, in your experience, like what is causing this? Why is this happening to guys out there?
Erectile dysfunction is it's probably old as time, as far as we know. So erectile dysfunction is at its core, it's a biological issue, and I want to be clear about that. Obviously, I'm a sex therapist, and we'll talk about more of the psychological or psychogenic elements to it. But even when erectile dysfunction is psychologically driven, it is almost always a inadequate blood flow, which is causing or facilitating like the erectile dysfunction. So I want to emphasize that the cause is medical, right?
Mm,
And that will be across the board. As men age, some of those physiological systems don't work as well. There's just wear and tear on the body. There's a slew of medical conditions that can impact blood flow.
mm,
Um, if it's okay with you, I would maybe ask this question a little bit differently, which is we've seen a tremendous rise in reported cases of erectile dysfunction in men under 40. And
yeah.
I think we can ask the question as to like what are the drivers in those cases? Like what is going on out there that those numbers seem to be on the rise, and
Mm,
whatnot. And I think that is um, a question that I don't think we know quite exactly what the answer is.
mhm,
There could be, like, again, a number of factors out there. Um, so just some of the things that I think is worthwhile considering is um, pornography. That's a big one, and how that's impacting people's psychology, how that's impacting their experience of erections. Um, the way we date, the way we engage,
mm,
expectations in dating, expectations in sexual encounters.
mm,
That's another factor which I think is important. There are a number of other possibilities out there that do um, I think go beyond my area of knowledge and expertise, including, what we eat.
Yeah.
There's so much processed food out there. There's so many things that are going on, and I'm not a alarmist about these things, but I recognize that they do matter. They do make a difference. And there's a lot of things that have changed just about, us as people, and our society.
Yeah.
So these are again all, different factors that might be contributing to a general rise in erectile dysfunction. The
Mm.
other point that I will make about this, though, is our reporting has gotten a whole lot better. So we
Mm.
are starting to see a general, I think, shift towards destigmatization of these conditions. And with the proliferation of online pharmacies that are designed for men who are experiencing erectile dysfunction, they're collecting data, and they're reporting that data. So it's possible that some of our reporting is getting better.
Mhm.
So what we don't know is that these numbers exist at this level 100 years ago.
Mhm.
We just didn't have any good way of collecting that data, but
Yeah.
now we do.
Yeah.
So that may also be a factor here. So it's just a blind spot for us in terms of knowing how much of the number is actually going up versus how much better is the reporting getting.
Yeah, yeah, and maybe that might be connected too with it, because from what I understood was the older that you got, the more like the higher this statistic was to have it, but perhaps maybe it's just that was the social norm, and so now younger men feel more comfortable saying that they are actually experiencing, or maybe it is environmental. It sounds like there's a lot of potential variables to
It,
uncover.
yes, more than I can count,
Yeah.
and I think to a certain extent more than we ever will know. Meaning,
Yeah.
I don't think we can account for all the variables.
Hmm.
But yes, historically, the perspective has been, and I think it continues to be, there are higher rates of erectile dysfunction as men age. I think that continues to be true,
Hmm.
but we are seeing I think, disproportionate rise in reporting of cases among younger men.
Yeah. And you mentioned this piece about like the way that we're dating. And I know a lot of guys on listening into the show are out there trying to find someone, are in the dating space. What specifically do you mean by that?
Um, so what I mean by that is, there are so many dating platforms out there, just online alone.
Hmm.
And a lot of times where erectile dysfunction is being reported has to do with partnered sexual activity. There are people that have developed full relationships online before ever meeting somebody in person. There's a lot of people who maintain primarily a lot of their social connections are internet based. I don't think we know enough about the impact on one's psychology, as well as how one navigates the transition from an online relationship to an in-person relationship. That would be one aspect. Another aspect is, some of those dating platforms are primarily designed for what's called hookup or hookup culture,
Hmm.
which means that there's an expectation, oftentimes, that there will be sexual activity at that first meetup. So for men who are more relationally based, who need to feel like a bit more of a sense of safety and security, they're going to be prone to having higher levels of performance anxiety or just being anxious stepping into a scene like that.
Hmm.
And it certainly is not an uncommon presentation that I've seen here in my office where, either a gentleman who's exited a long-term relationship and is like getting reacclimated to what dating looks like in 2024,
Hmm.
or younger men who are just discovering about themselves that they're more relationship oriented than perhaps they assumed, or more relationship oriented than their peers. And they're continuously running into problems specifically with the dating apps that are designed for, or it's implied that there will be
Hmm.
sexual activity early on in the process.
That's so fascinating. And I could see also perhaps even like that. I know a lot of guys I talk to, there's this pressure to perform. And it's like in those sorts of environments where the first time you meet, there's almost like this expectation would increase the pressure to perform. Or if you've never met this person in real life, but you have this whole like prolonged connection online, when you meet in real life, there's probably even higher anxiety or higher pressure about like how you're going to interact with one another, or like how to show up as this person that they've built this story around you being.
Exactly. Exactly.
Yeah. Oh my goodness. Okay. So it sounds like there's a lot of reasons why this is unfolding. Yeah, I guess what have you found that's perhaps maybe like the most surprising cause, maybe from working with a client, or is there something where you look at it and you've been a little taken aback to recognize that that's been a proponent of leading to ED?
It's a great question. And yeah, I'm just thinking about like different versions of myself in this
Mm,
process.
hmm.
So I would say today there's very little that surprises me.
You're like, I've seen it
Um,
all.
I wouldn't say I've seen it all, but I've seen enough and I've been surprised enough that
Mm,
the element of surprise is no longer there,
mm,
uh, in a certain sense. Um, I think one of the striking drivers that I've seen is it's a little bit tricky. So let me kind of back up here.
mhm,
Um, there's a lot of men who are reporting erectile dysfunction that are
mm,
having much more of like a situational erectile dysfunction.
mhm,
They're just not sure how to name it. So, men who are in relationships where communication is really, really difficult and they know things about themselves that they are hesitant or just unwilling to share with a partner.
mm,
Those situations, I think, continue to kind of strike me, because like here you have like all this really important information about yourself, and you know it, but you're just not willing to say it out loud, and like the problem persists, because whether it's something that you are scared about a partner's reaction, unsure about what they are thinking, you have a particular interest, a fantasy, sometimes even a fetish, but you're embarrassed to bring it up. And meanwhile, like you're, turning to somebody for help, which already takes a lot of courage, but are unwilling to bring that back to a partner.
mm,
That situation, I think, still is something that I find just really, really intense,
mhm,
and upsetting in certain ways. That it's like right there, but just so difficult and so hard to take that next step,
mm.
and actually engage one's partner around it.
Yeah. Yeah. And so I guess how would someone recognize that they have a situational dynamic unfolding versus thinking that they have a diagnosed prolonged issue? Like, how do you, yeah, face that?
That's a another great question. So it usually happens like one of two ways primarily. Um, One, somebody is engaged in an affair,
Mm,
or has been engaged in some type of affair. Or two, they use their solo sexual activity as a barometer. And that is a very common presentation, that guys are not able to gain and maintain an erection with a partner, but on their own, they're doing perfectly fine.
yeah.
And oftentimes the erotic material that they're engaged with could be like an indicator. And I want to emphasize is not that the material is causing erectile dysfunction. I think that's a big misnomer out there.
Mm,
But the material is never going to judge them or shame them, and they're able to engage in more of the things that speak to their
mm,
wants, desires, to the pleasure regions of their brain. But getting that to translate into partnered activity becomes a lot more difficult.
yeah. And then I could see how that would go back to the having this knowing who you are and what you like, and then not feeling like you could share it. And
Exactly.
then, yeah, interesting. Yeah. Well, I guess like at what point should somebody seek help? Like where is the kind of tipping point where maybe they've noticed that this is going on for a while, or how how do you recommend someone know when it's time to ask for help or to share it or talk about it?
Another great question. So I think this falls into two different categories. So one is if somebody's experiencing erectile dysfunction, really, really important to go for medical treatment first and
Mm,
foremost, or medical assessment. Um, like I mentioned before, erections work off of blood flow. And while it's not necessarily like overly common, it's common enough that a lack of erection could be like a canary in the coal mine for other circulatory issues that are going on.
Mm.
Without getting too deep into this, a little bit out of my space, but what we do know is that the arteries and veins in the penis, like in a couple other areas of the body, are like the absolute thinnest, or
Mhm.
not absolute thinnest, but they are among the thinnest, I should say, or the most narrow. So sometimes like that's where problems begin to emerge.
Mm.
That like when you have wider arteries in other parts of the body, even if they start to experience problems, they oftentimes can allow enough blood flow that you're not seeing anything problematic right now. But in
Mm.
the penis, like it could be a sign of underlying problems. So for that reason alone, I encourage everybody, go talk to a doctor, talk to a urologist. That should be your first line of treatment. I also like recommend generally for sex therapists, like really should be careful that like these are medical issues, a medical condition, and I don't see anybody unless they've been medically cleared. Like
Mm.
that's
Yeah.
my policy. Because I do see it as like something that has to be done properly. Now, in most instances, it's not a medical issue. In most instances, there's no blockage, there's no underlying thing, but it does happen. So
Yeah.
number one, when we talk about treatment, like medical, that's the first line. Okay.
Mhm.
There are situations though where even myself, like I would be comfortable like to treat if it's not, even if somebody has not been medically cleared, so to speak, like they're getting erections in a bunch of situations and they're in one specific situation where it's not
Mhm.
happening.
Mhm.
Like the body does not distinguish between those, the mind does. So in those instances, the question is when should somebody reach out for help? Okay.
Mhm.
Not getting an erection once is usually not an indication of anything. Like we said, that 6 month
Yeah.
window is usually a pretty good window. However, that's why I was like, try to be careful when you ask me this question at the beginning. If you are noticing that you are becoming increasingly distressed about this, okay,
Mm.
waiting for 6 months to see if it like heals itself or clears up or whatnot, oftentimes is not going to work. And by the time you get to 6 months, like you know, performance anxiety and anticipatory anxiety that goes along with sexual activity is usually pretty compounded at that point. That I would say is that like you got to know yourself. If you're feeling really anxious about this, if you're ruminating about it, like it's probably time to seek help,
Mhm.
and start to work on that.
Mm.
If like your anxiety profile is one where you're pretty cool and like you're pretty like you don't feel a lot of anxiety generally speaking, and you're not really panicked about this, I think that you have a little bit more leeway here, a little bit more time
Mhm.
before I would say it's really time to seek help.
I really like that breakdown of it's almost like kind of a step process of like understanding the duration of time, assessing your level of distress about it, first getting medical help, then looking at it from a psychological perspective or doing both and seeing what is underlining this issue. I guess thinking that, there's two people typically in a relationship. What do you say to the person that's in a partnership or that's sleeping with somebody that is experiencing ED? Like, I guess, what is, first of all, like the worst thing that someone could do if their partner is having erectile issues?
Well, I mean, the worst thing they can do is leave.
Uh,
Yeah.
okay.
So that's the worst thing they could do, right?
Mm.
And arguably it could get worse than there. Like again, criticism, shame, blaming, like those are like obviously things that are not helpful. Ultimatums,
Mm.
demands, making the viability of the relationship dependent on like erections and sexual activity. These are things that are all not helpful.
Mhm.
Um, the other piece that's really unhelpful in a lot of ways is when partners internalize
Mm.
responsibility for their partner not getting an erection. And like, while I will acknowledge that there are some instances where there's an attraction issue, it does happen. I can't deny that.
Mhm.
But I would say in the vast majority of situations that I've encountered, that's generally not what's happening.
Mm.
It's generally not a lack of attraction towards a partner. And I would say that there are way more partners who have reached that conclusion than there are men with ED who are actually thinking, if my partner was just a little bit more attractive, right? Or if, he or
Yeah.
she lost weight, or like, it's just, I just don't encounter that
Hmm.
very often. It's a very rare presentation.
Yeah. Yeah. And it's so hard just as humans not to take that on as our own or put it on ourselves. Okay, so what is the best thing that someone can do? Let's say that they're in a situation, they're hooking up and he can't get an erection. What would be the gold standard?
Well, it's interesting. You said hooking up. And
Okay.
that's a really no, it's a really I think it makes a big difference
Mm-hmm.
because like there is again, it goes back to like there's a pretense.
Mm-hmm.
So like if we were meeting up to hook up and you have ED and you know it, like you kind of misled me,
Yeah.
right? Because we matched, we went out of our way like to make this happen. And like I don't love to say it this way, but I understand there's an element of like a quid pro quo,
Mm-hmm.
right? That's why we're meeting up here. Like we don't really know each other, like we're not
Yeah.
really well. So if we're talking about like a pure hookup,
Got
like
it.
I don't have high hopes or high expectations
Mm-hmm.
that like beyond just basic human decency,
Mm-hmm.
that somebody is going to shift into like an overly supportive role in that
Yeah.
situation.
Yeah.
Like
I know that makes sense. Yeah.
yeah, if
Okay,
somebody
so
if
let's
somebody
say
does that, like I tip my hat to them. They're really like a great, like
yeah.
a really good person. But I certainly understand the frustration and feeling misled and feeling like
Yeah.
they wasted their time. So I think like
Yeah.
human decency. If you're talking about somebody who's in a relationship
Yeah. Yeah. Yeah.
and like they're going to engage in sexual activity and something like this occurs, and I'm assuming you're talking about a situation where this has occurred already.
Hmm.
Like this, we're beyond the initial shock of all of this.
Yeah,
Like
maybe, yeah, like the first couple times, or it's been going on for a while. It's starting to become a thing.
yeah. So yeah, this is going to really vary from situation to situation,
Hmm.
because each person listening to this knows a lot more about their relationship than I can possibly cover. Um, I encourage people to de-emphasize the role of an erection in their physical intimacy, just like acutely. There's a lot of options out there for many people, and I don't want to take away from the fact that for some people, um, having a full erection, generally for penetration, is even thinking on the partner side, is like a must-have. Like
Hmm.
there are some people out there like that, but again, I think that is certainly the exception, not the rule.
Hmm.
And I think there's a lot more panic about not having an erection in those moments ready for oftentimes some form of penetrative sex, than is warranted. So when these things happen, I think having alternatives, like, and when I say alternatives, I don't mean runner-ups or second bests. I mean just another way of engaging, which
Hmm.
is fully satisfying and everybody can walk away with a smile, and whatnot. I think that that's a really important thing to develop. Most of the time, it takes some conversation outside of the moment, right? To say, hey, it's no big deal. We're just going to shift over to doing X, Y, and Z or A, B, and C instead of, proceeding to penetrative sex or oral
Hmm.
sex on him or whatnot.
Hmm.
I found that has been something which I think is generally helpful for a lot of couples, and it helps to take the pressure down. Paradoxically, over time, it can just lead to not hitting that pressure cycle in the first place and having more consistent erections as well.
Yeah. As you're describing this, we've had conversations on the show about what to do if your partner can't have an orgasm, like in a heterosexual relationship. And this sounds very similar of like removing the goal. In that case, it would be to help the partner have an orgasm. This is like to have an erection. So like shifting the focus into something else that feels and is just as connected and intimate, just in a different way.
hmm
Yeah.
That's yes, exactly right.
Yeah.
And
Yeah.
just to kind of piggyback off of that, so like in I make this point to men a lot of times, like in like specifically in heterosexual relationships, like if your partner does an orgasm through penetrative sex, and they tell you that's just how I am, like that's how it works. So like I do, but maybe it's only like 10% of the time, and I'm not sure exactly why that is and whatnot.
Mhm.
for some reason, men have a much easier, like they go way easier on their partners than they do on themselves, right? In other
Mm,
words, they have these like high expectations that they're supposed to be showing up and delivering every single time, every single experience, okay? Because they don't want to disappoint their partner, who oftentimes seems to be okay to say, well, look, this is just how it works for me. I mean, I'm
hmm
not showing up here 100% of the time. I can't give you a 100% guarantee.
Yeah.
And like a
Yeah.
lot of men are like, okay, I get it. Like that's how it works for you. But like I have a responsibility to
Mm,
show up here 100% of the time. So they afford their partners in many instances a
mm,
lot more understanding and care and empathy and support than they're willing to offer to themselves.
mm.
And sometimes pointing that out to men and letting them just kind of like digest that for a moment can be helpful to say that, you know what, I don't have to be a machine. Like, I don't have to show up here every time, especially because this is meant to be an intimate experience with this partner who, like, themselves doesn't always show up, and they're okay with that. So why do I have to put all this pressure on myself?
Yeah. I'm like, why do you think that is? Like, why do guys do, like, why would someone do that?
Why would somebody put that pressure on themselves?
Yeah.
So I think some of it is probably societal. Some of it is just like again these expectations creep in. But there is a lot deeper psychology I think that goes into men's experiences. So most men come of age and go through puberty at a time when there really is no such thing as inconsistency in erections. There's no such thing. It just doesn't, it's unheard of.
Mm-hmm.
And a lot of that has to do just like the amount of hormones that are pumping through, and they're young, and like, everything is new, and prefrontal cortex is underdeveloped. A lot of things are just not in the way. So I do believe, and again, I don't have any specific data to back this up, besides just anecdotal things, but I think that men become accustomed that like the erection is always there. It's always going to be there. Why would it not be
Mm-hmm.
there, right? You just grow accustomed to it. So the idea of having to adjust to this reality, I think, is very difficult. I think like female counterparts a lot of times like did not have an experience where it just works every single time, no matter what I do, right? It's just there. It just always works. So I think that there's a much bigger learning curve for men to adjust into this because their starting point is very different. So I think that there's probably, again, layers to the psychology here of why it's difficult to accept that it doesn't
Mm-hmm.
always work as
Yeah.
planned or as expected.
Yeah. Yeah. It's like starting at 100% and then over time it drifts down, whereas women's almost going like the opposite direction.
Yes, yeah.
Yeah. Yeah. Oh, wow. That's a really interesting way to look at that. I totally just lost my train of thought with that thought.
Okay.
Um, oh, I had a question for you and I lost it. Oh yeah. So, I mean, I guess it sounds like a part of this is there's an element of acceptance that perhaps like and the ability to accept that maybe I'm not going to have a 100% satisfaction guarantee like to perform the way I did when I was a little kid. Like there's a piece of being okay with that. But then also, I guess, we obviously can't do a full therapy session here with you today, but what are some ways that maybe like either questions to ask or some ways to start taking action to reduce or improve the symptoms, whether it's, yeah, what would you recommend someone do?
Yeah, so that's great. So the answer is absolutely. There's a lot of things that men can do even before coming to see a therapist.
Mhm.
And I make this point to people that I speak to on podcasts and whatnot. So like number one, like recognize that when you experience something like erectile dysfunction or some other challenge, there's a tendency to catastrophize everything.
Mm.
Like it's all over, like I'm aging, it's done, like I don't know what's going on, I've lost control of my body, what's happening. And in that panic, I think a lot of men lose sight of, well, this was like one time and three other times it worked and whatnot. So one of the recommendations I make is before even going to speak to anybody, start tracking things.
Mm,
Just start tracking things. Just start noting, like, oh, I woke up with an erection. Like I just jot it down even for yourself. Keep like a basic log because certainly from a psychological standpoint, and even sometimes from a medical standpoint, the details matter. Right? A lot of times, like the work that I do with men has to do with like finding the underlying patterns,
mm,
like finding situations which are more or less anxiety provoking. So just as like an example, like I have guys that I work with track all kinds of things that might not sound intuitive, but they really make a big difference. So one that I like because it's oftentimes it becomes more significant than often than men appreciate and than even I appreciate. But who initiated? Who
mm,
initiated? Okay, so like and either way could have a different outcome for different men. So
mm,
like for some men when they're thinking, well, yeah, I noticed every time I'm the one who's initiating, I'm like not performing well. Well,
mm,
because I was thinking about it for 19 hours in advance. Like I planned all my moves, right? But in planning all my moves out, like my mind, like the way it seems to work is that it also starts to get anxious about it.
mhm,
So like as we're getting closer, like what should be excitation, like an anticipatory excitation actually is an anticipatory anxiety. And I'm
mhm,
feeding it to myself because I'm planning the initiation. But I noticed that the times my partner initiated, especially like with spontaneity, it was just spontaneous. I caught me off guard. Like before I even had time to think about it, I was already getting an erection, and like lo and behold, I was fine. So it's these kind of details that I'm encouraging men like track, like
mm,
just like see what happens. What are the details? So like we'll talk about things like what was the setting, time of day, etc. So like that's definitely one piece that any man who's
mm,
experiencing like some inconsistency in erections. Like this is a worthwhile thing to do because the devil is usually in the details and
mm,
the solution that you're looking for is in the details. For many relationships, it doesn't take much to say, look, temporarily until I understand why I'm so anxious and I'm working on this, I just need you to initiate. And also don't tell me when it's coming. Right? Like I don't need too much of
right.
a heads up because it doesn't work for me, right? So like meanwhile, like the couple can
Mm,
protect a lot of the um subsequent like injury that happens to the relationship or even to each of them psychologically by just having some of the details and working with the parts that are working better
mm,
and not necessarily going down the roads that haven't quite been worked out yet.
yeah,
So like tracking, sequencing, like that's definitely one piece of advice that I would throw out there. I don't see any harm in it certainly. uh,
yeah,
that was one piece. The other thing is that just to kind of be aware that erectile dysfunction, like we're seeing in this episode, like is multifactorial, and
yeah.
there's a tendency to look for a singular, simplified answer because like when things are scary and they're uncomfortable and they're worrisome, like that's our tendency. We want to like simplify and get to an answer. Like for better or for worse, and I really think for better, it is multifactorial
Mm,
because while the challenges are coming from possibly multiple places, the solutions can also come from multiple
mm,
places. There's a lot of ways to address this as well. So I think recognizing it's multifactorial, it's not always just I'm anxious, sometimes it's, a stimulation issue. Sometimes it's a physical stimulation issue. Sometimes it's a relational issue. There's so many things that are possibly going on.
mm,
Don't limit the way you're thinking about this to, well, it has to be, pornography, right? It has to be my partner. Like it generally is more than one piece going on at the same time.
yeah. Wow. Yeah, I really love the tracking. I'm such a spreadsheeter. So I love being and you're right, like no information is necessarily bad information. So might as well get it and see what you
Mhm.
find. Thank you for that. Okay. So I have some questions that I thought I would share with you, whether it's from men that I've worked with or men writing in from the show. So I'll read you the question, the prompt, and then if you want to share any advice or how you would answer this, go
I'll do
for
the
it.
best that I can.
Okay. Okay. Um, okay. And this is interesting. After we've spoken, I feel like I some of these things might be obvious right away. So Sometimes I can still get morning wood, but not during sex. I recently went on a solo vacation for a month and I woke up with an erection almost every day. Does that mean I'm just not attracted to my partner anymore? It was a relief to know that I could get an erection, but now I'm almost more concerned about why this happens during sex.
Okay, so this really touches to the heart of a lot of things we spoke about. It's almost as if you wrote this question for me.
I shouldn't.
Yes, I know. Um, I mean, again, I would say like number one. So this is like a really good indicator that there's something psychological happening. When I say psychological, I don't mean necessarily on an individual basis. It could be a relational piece.
Mhm.
Um, Now, look, if you have to ask yourself, does this mean that I'm not attracted to my partner? Like, I think you've already answered the question, and the answer should be no. Because if you're not attracted to somebody, it doesn't take much to figure that out, right? It's one of the first things we do from a psychological perspective is
Yeah.
like we see somebody and we know, like, okay, this is somebody that like, fits my, general attraction profile. And we have like some, like, obviously we have elasticity with that to a degree, but we generally know that. So if you're saying, does this mean that I'm not attracted to my partner? Like a therapist can't answer that question for you better than you can. So, like,
Mm-hmm.
if you're looking at your partner and you're saying, generally, I find this person attractive, then yeah, you find them attractive. What is much more likely going on here, and I think I already alluded to this kind of situation, is that there's a performance anxiety. Like you're worried about, like you're up in your head thinking about like, is this not going to go well? And you're not pleasure driven when you're on a solo vacation. Like number one, when you sleep, like your anxious parts are largely shut off for most people. Not everybody, but for most people. And your body goes through this very natural process. So clearly he can get erections. Um, but number two is like there's no performance pressure. Nobody's watching, nobody's
Yeah.
looking, you don't, right? And like you can really be a lot more pleasure focused. So I would venture a guess that either one of two things. One, you're asking this question because you know there's some unattractive feature about your partner.
Mm.
That's number one, right? I don't think that's the case. And I would say if it is, try turning the lights off or dimming them, right? Or avoiding that piece, okay, unless it's like very much in your face.
Mhm.
But again, in all likelihood, there probably is a partner-based anxiety here that needs to be fleshed out a little bit more. Some of it may come from, a comment that was made. It may come from something, a facial reaction. It could be a miscue or a misread, or it could have nothing to do with the partner, and it could be something which is more paradigmatic to, I mean, you can have a partner-based anxiety without the partner being the one who caused that in the first place. Just people get nervous
Mm-hmm.
about their performance in front of other people.
Yeah. Yeah. Okay. I love it. Okay, next question. Here we go. I'm young and in good shape. Could my ED actually be caused by me masturbating too much or gripping too tightly? I don't like to masturbate any other way, but I'm starting to worry that this is causing issues when I have sex with a woman.
Okay, so this is a quite a tricky question.
Mm,
So when someone asks, "Could it be?" My answer is generally like most things could be.
maybe.
Like I can't I can't rule anything out. So there is a concept that we refer to called idiosyncratic masturbation,
Mm,
which means that there certainly is like a concept that we do habituate ourselves to a certain degree to certain forms of stimulation, whether that's, visual stimulation like pornography, or like physical stimulation, that we do become accustomed to like needing a certain amount of stimulation. So that part of it is true. Now, when we're talking about erectile dysfunction, this is where these different categories make a significant difference, in my opinion. So, if he's not gaining an erection in the first place with a partner, I don't know how much of that we really could attribute to masturbation,
mm,
because like that initial gaining of the erection usually is not associated with masturbation. However, if what he's referring to is losing his erection in the middle of sexual activity,
mm,
um, there is a possibility, I could hear a possibility, that having grown accustomed to a particular form of stimulation, That not being replicable, let's say if I'm assuming his partner is a woman, it's very difficult to replicate a tight-gripped, intense masturbatory
Mhm.
motion in a vaginal canal. They're just not, they're two very different experiences.
Mhm.
Now, can a person like relearn a lot of this? I do believe that's the case. And that it is possible that that's what he's experiencing. I
Mhm.
would say, in my experience of doing this work, it is more common that this type of setup or scenario would lead to a delayed ejaculation or an
Mhm.
anejaculation, meaning in a lot of instances there's enough stimulation to gain and maintain that erection,
Mhm.
but a lot of times not enough to get to a point of
Mhm.
ejaculation at the same degree or the same time frame as with masturbation. That would be a more common presentation. So all
Yeah.
that being said, to the person who wrote this in, I would say it is possible. And again, I'm not going to make any particular
Yeah.
recommendations of
Yeah.
how to go about approaching that. It is possible, but again, there also is a whole world of like psychology here because again,
Mhm.
there's performance anxiety, there's concern about what the
Mhm.
partner's thinking. There's a lot of other things that could be contributing to this as well.
Yes.
So there's a distinct possibility that what the writer says is a factor,
Mhm.
but there certainly are other factors that could be at play here.
Mm. Interesting. Yeah, it's interesting. Okay. And next question is, I've been struggling to stay aroused with my partner for the last year of our 5-year relationship. She wants to try some sexy outfits, role play to help, and even mention some sex toys for me. I love how committed she is, but I'm afraid I'll just feel more anxious. How can we avoid that?
Yeah, great question. That's a really great question, and it's a more common scenario than people think, but I would say, to me, it sounds just based on how this question has been, submitted, that, this person finds themselves caught in a pretty intense anxiety loop already, which
Hmm.
is, right, the things that I know should be working for me, right, to increase my arousal, what if they don't work, right? Like, what if it doesn't like, you can hear already the anticipatory anxiety of I almost don't want to let my partner do these things for me
Hmm.
because if I don't respond, it's going to be so much worse than having not tried it in the first place. Right?
Yeah.
I mean, it sounds to me like
Yeah.
like this person's already caught in a pretty intense anxiety loop. I think his intuition is correct that you probably should not proceed forward,
Mm.
like when you are that anxious, because it is a high probability things are not going to yield the results that you want, um, because like you're nervous about this. And this is a comment I make to a lot of men that I work with and whatnot. Like you can be in the most stimulating environments possible. But if your mind is preoccupied, and is in a state of panic or worry, it almost doesn't even see what's in front of you. It's
Mm.
not like your mind is not really there. When you're
Yeah.
anxious, you're in some future alternate world. You're not even present. And some of them that I work with, I'll ask them like, "Oh, you're describing this situation. Can you tell me like what did your partner look like?
Mm.
What was she wearing?" And they're totally blank. They have no
Mm.
clue, no
Yeah.
recollection because the anxiety, and this is like a hallmark of anxiety, it's a very future oriented type of experience. You're worrying about all these what if scenarios. What if something goes wrong? What if my partner leaves me? What, like, you're not present. You're really, really not here.
Hmm.
So, like, when people are that deep in anxiety, all these great efforts to try to increase arousal and increase stimulation and do something new and do something fun, I think it's going to leave the partner potentially in a very vulnerable place.
Mm.
And if this guy is this anxious as he is describing, it's not going to be
Mhm.
effective. So I'd say first step is you got to address the anxiety loop and put yourself in a
Yeah.
position where you actually can be receptive to some of these things.
Yeah. Wow. Okay. Last question. Um, I have here, I've struggled with ED for many years. When I was younger, I was sexually assaulted. How can I get past the psychological trauma that this has caused?
So I would say that this question I would put slightly I wouldn't say out of my wheelhouse, but I
Mhm.
would say it probably, touches on just more of it's a broader question just about trauma. I think it's
Mhm.
much more of like a trauma therapy.
Yeah.
Now, I want to be very careful about the following statement, which is this would be a good example from my perspective of having linked to events that we don't know if they're actually linked. In other
Mm.
words, like it is possible that early childhood trauma that this person is describing is what is driving the erectile dysfunction. Okay. But it is also possible that it is not. And
Mhm.
that's where I would be really, really careful and cautious about this.
Yeah.
I don't like to jump to any conclusions, even when it's like, oh, this seems really, really obvious, right?
Mm.
How could you not
Mhm.
see the link between these two? So I would say, pardon me, I would say to this person, it's important to address the trauma. That's number one. Like,
Mhm.
and the end goal of that should not be, or the measure for processing through the trauma should not be whether your erection improves.
Mm.
Okay.
Mhm.
If it does, great. You just killed two birds with one stone, right? And you don't have to go through the rest of the work necessarily for addressing the, psychogenic ED. But you should go in assuming that these may be two separate processes.
Mm.
Your end goal is to get there, like, but you've got to process through the trauma, and you've got to be open and not discouraged that that may not be the answer. This may be the red herring, which happens a lot.
Mm.
And when I hear like it could be trauma, but a lot of people like, and I think I even fielded a phone call today around this, which is, well, it was the porn that did it to me,
Mm.
right? So like
Mhm.
in an empathic way, I'm going to ask, well, how do you know that? Like, how
Mm.
did you come to
Mhm.
that conclusion? Because I don't know
Yeah.
that.
Yeah.
Right? I never know if it's that was the singular cause. So a lot of times, again, it goes back to like wanting to make that jump.
Mm.
So I would not be able to answer that question here other than saying you definitely should get the trauma, addressed. You definitely should go through that work.
Mhm.
And if like, and again, also like, and this is so hard to describe this. It's hard to say like when the trauma is resolved. I don't know if that's a
Yeah.
fair framing of
Mhm.
like trauma. I kind of look at it as like it's scar tissue, right? It kind of changes like a
Mhm.
person's life. Now they can live better, like they can live better than they ever would have before because of that. But it's hard to talk about these things like being fully resolved as if human beings get back to some kind of tabula rasa. So I want to be careful about
Yeah.
that. But if one feels like they've processed through that trauma and the erection issues are persisting, number one, it could be that there are other causes. Number two, many people develop a secondary anxiety to um, the initial trigger. So sometimes like they had like a trauma or they had some kind of like issue occur that acutely caused erectile dysfunction, even physiologically. It's fully resolved. They're ready to go. But now their mind is like, what if it happens again? What if, right? So sometimes it's secondary anxiety that kicks in over the years, and we have to be able to get to that to really fully resolve the erection issues.
Wow. Amazing. Okay, Mark, thank you so much for coming on to the show today. Where can everybody find you if they want to work with you? I know you have a booming therapy practice. You have a podcast. Share away. We want to know.
Okay, so first of all, thank you so much for having me on. I like being on the other side of the podcast at times. Gives me a lot more freedom to talk and answer questions and things through. So I really appreciate the
Mhm.
opportunity to do that.
Amazing. Cool. Well, thank you so much for coming on this show and yay erections, you know?
I'm definitely a big fan and a big proponent.
Thank you so much for tuning in to this episode of The Naked Connection. Be sure to subscribe so you don't miss another episode. Trust me on this, your sex life and that special someone in your life will thank you for it. And if you really love the show, please take a moment and leave a 5-star review or a written review and let me know what you think. It would mean so much to me and this show. Until next time, happy connecting.